Hello friends, today we're going to discuss about breastfeeding. In this video we're going to know the two things of breastfeeding. First is what is the correct method of breastfeeding. Secondly is what is the importance of breastfeeding and breast milk to a baby. First is what are the correct method of breastfeeding. To start with, and in antenatal period, mother should be motivated for breastfeeding and its benefit. Secondly, inverted and cracked nipple or some other disease of nipple that are present or diagnosed before pregnancy or during pregnancy should be treated as early as possible so that baby do not face any problem after birth. Thirdly, mother is advised to put baby to the breast for the breastfeeding immediately after she recovers from the exhaustion of labor, preferably half an hour after normal delivery and 1.5 hours after the cesarean delivery. Now the mother should advise to feed the colostrum to the baby. Many believe that this colostrum is a witch's milk or the milk that will harm the baby. But on contrary to that, this is one of the most nutritious and beneficial breast milk that can be given to a baby. It is usually the milk that comes out within 72 hours after delivery and has a color of little bit pale and grayish in color. Next is that mother is advised to feed the baby 2 to 3 hours on the semi-demand schedule, and while feeding the baby, mother should empty one breast at a time. That is, first the mother should empty one breast and then the another breast. Mother should sit up comfortably and keep the baby's head slightly raised above on her elbow so that the baby do not undergo gastroesophageal reflux. Then the baby must grab the areola and part of the breast tissue into his or her mouth during sucking at the nipple. And after each feed, baby should be bathed by holding him upright against the shoulder to prevent the regurgitation of the feed. Baby is preferably put in a prone position on right lateral position with head end slightly raised to prevent the regurgitation due to gastroesophageal reflux. Mother should actively interact with the baby in breastfeeding to prevent the baby from falling asleep during feeding. When baby becomes slow, mother should gently pull her nipple out when the baby will come out of the slumber and restart sucking with a renewed vigor. During first 4 to 6 weeks, most of the baby need to feed round the clock, and it is to be encouraged that the breastfeeding should be done on demand basis. Give no artificial teat or pacifier with the breastfeeding baby is the rule, and baby should not be given anything except breast milk for at least 4 months unless medically indicated, and this is the dictum for exclusive breastfeeding. So these are the some corrective method for the breastfeeding which many mothers do not follow and hence sometimes develop breastfeeding related complication. Now the role of breast milk in physical and mental growth of the child. That is what the role of the breast milk in the development of a baby. In this regard, we want to mention that why mother's milk is most beneficial to a baby. Well, it can be categorized into 3 important factors. First is the mother's milk is nutritionally superior. Secondly is that mother's milk is immunologically superior, and third is mother's milk also act as an epidermal growth factor. So how this help? Let us know in detail. First is why mother's milk is nutritionally superior. It has been found that the carbohydrate that is present in breast milk is particularly of high concentration, about 6 to 7 milligram per day. The most important of carbohydrates that are present in the breast milk are lactose and galactose. Galactose is responsible for the formation of galactose and lactose is responsible for absorption of calcium and formation of lactobacillus within the intestine. So galactose help in keeping the nervous system of the baby healthy, whereas the lactose help in keeping the gastrointestinal system of the baby healthy. Second is the protein. Protein content is low, 0.9 to 1.1 gram per dl, as baby cannot metabolize protein, especially the heavy protein load. The two important protein that are present is the lactalbumin and lactoglobulin, which are very easy to digest, and the mother's milk have these two protein particularly in high concentration among the protein overall. And also the protein of breast milk have taurine and cysteine amino acid, which are exceptionally important for neuromodulation and neurotransmission. Thirdly is the fat. The breast milk have rich in fatty acid, so it is also necessary for myelination of nervous system. Omega 2 and omega 6 long chain fatty acids, which are very much essential for cholesterol and prostaglandin formation, are also present in breast milk. It contains lipase for the digestion of fat as well. Now the vitamin and mineral. In vitamin and mineral, the quantity and bioavailability of the vitamin and mineral is sufficiently adequate for the child up to 6 months of age. Then the water and electrolyte. The baby's milk, the breast milk is nearly 88% is of water. So surprisingly, baby's mother's milk do not require any other water supplementation. So we generally tell that baby should take breast milk and nothing per mouth except the breast milk, because it also satisfies the need of water. Lastly is that the baby's the mother's milk has a temperature which is equal, almost the same as that of the baby, and also free from any contamination, as the other fortified milk can have. So these are also going in favor of breast milk. So these are some factors that are responsible, that are make the breast milk nutritionally superior. Now why we have told that this is also immunologically superior? Well, it is immunologically superior because it has been found that the breast milk also have a high concentration of immunoglobulin A, macrophage, lymphocyte, lactoferrin, lysozyme, binding factor, and intestinal natriuretic factor. Once again we are repeating, it have high concentration of immunoglobulin A, macrophage, lymphocyte, lactoferrin, lysozyme, binding factor, and INF factor. So baby has a significantly less chance of developing diarrhea and acute respiratory tract infection. And thirdly is the epidermal growth factor, which enhances the maturation of intestinal cell and reduces the allergy early in life. So the epidermal growth factor is also needed for the healthy baby. And ear infection, orthodontic infection, and problem of heart disease, diabetes are also found to low because of this property of breast milk, that is epidermal growth factor. So we have seen that the breast milk by all way is much better than that of the milk that are present in market today. So it is advised that baby should get only breast milk, or should be fed only breast milk up to 4 months of age, and after that we should gradually change the baby's diet from liquid to semi liquid to solid. So this is our discussion on breastfeeding. Hopefully you have been benefited. Thanks a lot.